Yeah,
Hey,
hi.
good morning.
Thank you so much for joining us. I just want to introduce you to my community, our community of servants. Originally, when we asked you to come and speak with us at our healthcare conference in March, you were so gracious. And what we had planned was you were going to come in person. And we were all going to jump up and give you a standing ovation because we appreciate so much your servant's heart and your commitment to the vulnerable people in Tennessee. And we're just thrilled to have you. I'm going to quit talking because we want to hear from you.
I appreciate that. And I don't need a standing ovation. Y'all are the ones that do, because you're actually the ones that are doing what I'm so supportive of. And, I have a lot of, I have friends on this call, certainly because of the work I've done in the past and organizations that I've been connected to. A lot of y'all, I know who you are and what you do, and have had a long history, probably more supporting than really being very engaged. But I deeply appreciate the role that you play. And I got to tell you, now that I have found myself in this position and understand more fully the needs out there, now that I'm in this position, I appreciate what you all do even more than ever before. So we have great challenges in our state. There are a lot of folks who have a lot of challenges and stresses and difficulties in their life. There are a lot of folks that are underserved, a lot of folks that don't have access, a lot of folks that don't have insurance, a lot of folks that have not, except for the work that you do, would have nowhere to turn with regard to their health. And that's a deep concern of mine. And so I've often said that government is not the answer to the greatest challenges that we face in our community. And government's not the answer. Government can create a vehicle and create an environment and provide funding or provide resources or elevate conversations or convene. But the work of addressing the greatest challenges in our history, in our communities, happens in the community. And it happens by the people, happens by the faith community. It happens with community organizations, with nonprofits, with individuals who care about their neighbor, who love their neighbor as themselves, who serve their neighbor, who recognize that the most fulfilling and purposeful things that happen are when we serve those who cannot on their own get their needs met. And certainly Jesus understood that. And a lot of my interest in serving comes from my deep-seated faith. And while everyone on this call is not a faith-based organization, I think that what I'm trying to say is that I think just everyone on this call is interested in serving and loving their neighbors and taking care of folks that need a hand up. So thank you. Thank you for what you do. I'm proud we could increase funding to these organizations. I believe I was talking to Dr. McDonald this morning in our health department about the partnership that our Department of Health has had with the multiple locations and organizations that are represented here. You're spread out all over the state. You serve populations that we desperately need to reach. You have access to them, but most importantly, they have your trust. So I've long believed that local interaction with people is how you build trust. And there are a lot of folks who, in general, have a level of distrust in the public health system. And in populations with good reason from histories in the past, have developed a lack of trust in the public health system. So what they need are trusted health partners, and that's what you represent. And that's the reason that you're such a good partner for us. So if we want to do COVID testing in a Hispanic community, or because we know that COVID disproportionately impacts people of color, And we need to be testing those communities. And there are reasons why they have not had full trust in public health and from past history. So we partner with you all, and you help us get that done. We serve those people, and we couldn't have served them otherwise if it weren't for the work that you do. So that's one small example of how I've seen this partnership work. But it is not the state doing that. It really is you doing it. So I just wanted to come on and tell you that we're grateful. The people of Tennessee are grateful. I want there to be more of this type of network and this type of organization, this type of work across the state. You know, we created something called the Office of Faith-Based and Community Initiatives, and it's independent of, it's in the governor's office. It's not related specifically to health, but it is created to be a liaison between nonprofits and the state government, so that we can network people together and build relationships and build the kinds of collaboration that's really needed to get things done. That is a piece of what we're hoping to expand. I started this by saying, I hope there's more of this. I hope there's more of you. I hope you get more resources so that you can provide a greater level of services. It's one of the reasons we put, of all of our CARES money, we took $150 million of it and we pushed it out to nonprofits, because we pushed it out to businesses, we pushed it out to governments and local governments, and we pushed it out to nonprofits, because we know that just a whole lot of the real hands-on, boots on the ground, meeting the needs of people and communities all across the state is being done by nonprofits, both faith-based nonprofits and community-based nonprofits. So I say all of that to say thank you. I'm grateful. We want to do more. We want you to do more. And we want you to let us know how we can be a better partner. So you all know you have connections with us. You have connections to either through our Office of Faith-Based, through our Departments of Health, directly into the governor's office. You also have relationships with legislators in your districts that we work with every day. So we want to hear, we want to know, we want to understand better, and we want to be a partner. But mostly we want to thank you very, very much for the work that you do in Tennessee.
Oh. Thank you so much, Governor. We have a long way to go. We are so grateful for the partnership we have had. The Department of Health, generally, rural access and minority health have just been so tremendous.
Mm-hmm.
And Dr. McDonald, she's just always there when we need to reach out. So many people, I couldn't begin to name them all, what wonderful public servants they are. It's very helpful. So we will just want to let you know that we support your efforts
Great,
to
thank
improve.
you.
And we'll
let me say one last word. We with the crisis that we have around us, we all have a greater challenge. Unemployment, additional stress, certainly the mental health challenges. We know that abuse is up, both domestic and child abuse. We know that mental health challenges are up, suicide rates are up. We're in crisis. People in crisis have exacerbated health situations and conditions, and besides the fact that many of them have lost insurance through the unemployment situation. So we have a greater challenge ahead of us, and all the more reason that I am grateful for what y'all are doing. I will say this, I'm pretty hopeful. I think challenges bring about transformation, certainly in my own life. God used the most difficult days of my life to make the most profound impact in a positive way on me. And I believe that for our state. I think we learned something about our healthcare system through COVID that we didn't know before. We're still assimilating that, right? We're still understanding it. We know we got a big challenge and more people, but we also know we're a lot better at what we do today than what we did 6 months ago even. And so while everyone on this call has an enormous challenge before them to serve in an increased level of need, but I'm hopeful. I'm actually excited about what the future holds for this kind of partnership for public health, for serving the underserved in the future, because we're being transformed through it. So thank you again.